Thank you, Dr. Sahani sir, and good evening, good afternoon, and good morning. This is the 1518th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Amrutha Manoharan. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. Hindi session from 7:30 to 8:30, and the international session from 8:30 to 9:30, and 9:30 to 10:30. We have a local language session in Malayalam. Today, we are very happy to have Dr. Amrutha Manoharan as our faculty, but she has taken so many sessions in our forum 2 years back. Anyway, she has completed MD in homeopathy and diploma in yoga, diploma in naturopathy, diploma in clinical cosmetology, PG diploma in hospital administration. She is the chief physician at Amma Homeopathy Clinic, Kadakal, Kollam, Kerala, and she has several worked in several fields. Was the former assistant professor, White Memorial Homeopathic Medical College, was the former lecturer at Nightingale College of Nursing, former senior research fellow, National Homeopathic Research Institute of Mental Health, Kottayam. And today, Doctor will be discussing a very important subject, polysystemic vira and homeopathy. We proudly welcome Dr. Amrutha Manoharan to this session.
Good evening, sir. Thank you all.
Yes, you can begin the session. As there was some technical issue with the laptop, Doctor is talking from the phone. Yes, Dr. Amrutha.
Sir, is it visible? Visible, sir?
Noted.
Oh, sorry, sir. So today we are going to discuss about polycythemia vera and homeopathy. So I'm extremely sorry that I cannot screen share it. So as we all know that polycythemia is a myeloproliferative disorder. Before that, I thank God Almighty, my beloved parents, my respected teachers, and my humble pranams to our beloved master Samuel Hahnemann. So, as always, a student of homeopathy in the past, present, and the future. So, what is red blood cells? As you all know that it is just brushing up of your physiology class. So, red blood cells, as you know, the cells also known as erythrocytes, they are a type of blood cell that mainly function in the transport of oxygen and carbon dioxide throughout the body. So the main function is it carries oxygen from the lungs to the body and return carbon dioxide. Okay, sir. Sir, regarding red blood cells, so they are also known as the erythrocyte, and the main function is the transport of oxygen. Okay, main function is the transport of oxygen and carbon dioxide throughout the body. So the structure of RBC, it is a biconcave disc-like shape, and it lacks nucleus. Okay, RBC lacks nucleus, and it has thereby more storage for the hemoglobin. So usually the lifespan is about 120 days, and the significance, it constitutes about 40 to 45% of the blood volume. So why are they red in color? Because of the presence of hemoglobin. Then the shape, it is a biconcave disc-like shape, and the diameter size is about 6 micrometer in diameter. And there are some facts regarding RBC. There are about 150 billion red blood cells in about 1 ounce of blood. So what makes RBC unique? RBC are unique because they are having no nuclei and allowing more room for the hemoglobin. They are having a shape known as the biconcave disc-like shape, and also they are having no nucleus so that they can be easily pass through. They are very flexible, then they can pass through every small blood vessels. So polycythemia vera. So polycythemia vera is an extremely one of the important myeloproliferative disorder. So polycythemia is characterized by myeloproliferative neoplastic disorder, which involve uncontrolled red blood cell production, which result in elevated red cell mass. So there are mainly two types. Simply saying that in polycythemia, there will be increased amount of red blood cells and red blood cell mass. So there are two types. One is the relative polycythemia and next one is the absolute polycythemia. In relative polycythemia, we can see that there will be increased amount of hemoglobin, that is the erythrocyte concentration compared to the plasma oleum. This is the relative polycythemia. Next one is the absolute polycythemia. Here we can see primary and secondary. Under primary, we can see polycythemia vera mainly occurs due to the erythrocyte receptor mutation. And in the secondary polycythemia vera, it mainly occurs due to two mechanisms. First one is the any compensatory mechanism, and second one is the abnormal presentation. So, in compensatory mechanism, in response to carbon increased carbon monoxide or carbon dioxide, and also in response to high altitude, etc. In the abnormal polycythemia, other reason mainly due to the erythropoietin like substance secreting tumor, mainly in the renal cell carcinoma or hepatocell carcinoma. So polycythemia is the increased amount of the red blood cell in the body. It is of two types, relative and the absolute. Relative means only the amount of hemoglobin, only the amount of erythrocyte will be raised and the plasma volume will be low. But in absolute polycythemia, it is of two forms, primary and secondary. In primary, we can see polycythemia vera, and in secondary, we can see two forms, that is the in the compensatory form and also the abnormal form. Compensatory form occurs in response to hypoxia, COPD, high altitude, or carbon monoxide poison. And another reason is erythropoietin secreting tumor, mainly in the renal cell carcinoma or hepatocell carcinoma. So the main pathophysiology in polycythemia vera, the bone marrow contains normal stem cell along with some abnormal clonal stem cells, which has action on suppressing the normal stem cell growth. There will be normal cell present along with some abnormal clonal stem cells that mainly act on the suppressing of the normal cell growth and the maturation. So this is a genetic mechanism, and the gene involved in polycythemia is JAK2 gene or the Janus kinase gene or the JAK2 gene, a gene that makes a protein that cells signals into the cell to promote cell growth and helps in controlling the number of red blood cells and white blood cells. So when there occurs any defect in the JAK2 gene or any mutation there occurs, it lead to the abnormal signaling of the JAK2 gene and ultimately lead to increased production of the red blood cells along with the other blood components. So the main symptoms. So usually the patients with the polycythemia will not be coming to you directly by saying that the patient is having polycythemia. So it is accidentally being diagnosed when a patient is undergoing any blood test. This polycythemia condition is accidentally diagnosed when the hemoglobin concentration will be more, that is more than 16 like that. So more 16 to 17 like that. Okay. Some people with polycythemia vera does not have noticeable signs and symptoms, and some persons might develop vague symptoms such as the headache, dizziness, fatigue, and blurring of vision. So the main symptoms include headache, dizziness, and fatigue. The other associated symptoms include tinnitus, vision changes, insomnia, claudication, and aquagenic pruritus, gastritis, and early satiety. Early satiety. So some less common symptoms include itching, especially after the warm bath, numbness, tingling, burning and weakness, a feeling of fullness as soon as eating, mainly due to the bloating as a consequence of the enlarged spleen. So once again, we are dealing with the main symptoms of polycythemia. It include headache, dizziness, fatigue, tinnitus, vision changes, insomnia, claudication, aquagenic pruritus, gastritis, easy satiety, early satiety. So itching, especially after warm bath, numbness, tingling, a feeling of fullness on the abdomen after eating. So polycythemia vera is a disease condition. There is an unusual bleeding will be there from the side, mainly from the nose. Okay, unusual bleeding from the side, usually mainly from the nose, and painful swelling of one or other joint, mainly of the big toe, and the patient will develop shortness of breath and difficulty in breathing while lying down. These are the main symptoms of polycythemia vera. So, based on the system affected, on the central nervous system, we can see fatigue, headache, and dizziness. On the peripheral nervous system, we can see paresthesia and weakness. On the thoracic region, we can see chest pain, shortness of breath. And on the gastrointestinal system, we can see abdominal pain, history of recurrent peptic ulcer disease. And on the skin, we can manifest it as myalgia, erythromyalgia, or red-dust appearance of the face. On vision, we can see vision loss or blurred vision. The main psychiatric symptoms include depression. So, based upon the system of the body affected, it may produce the polycythemia may produce multi-system disorder or multi-system symptoms. And the main system symptoms in the central nervous system include fatigue, headache, and dizziness. On the peripheral nervous system, paresthesia and weakness. On the thorax, we can experience chest pain and shortness of breath. On the gastrointestinal system, we can experience abdominal pain, history of recurrent peptic ulcer, and early satiety. Then on the skin, we can experience myalgia, erythromyalgia. On the vision, we can experience loss of vision or blurring of the vision. On psychiatric symptom, we can experience as depression or depersonalization. So this is the polycythemic smear. I'm sorry, I cannot show it. So there are many complications of polycythemia, mainly thrombosis, hemorrhage, hepatosplenomegaly, aquagenic pruritus, hyperuricemia, erythromelalgia or visual disorders, then myelofibrosis and acute leukemia. So allopathic treatment, the main allopathic treatment is phlebotomy, that is a bloodletting, and also some medications which act as a myelosuppressive medications. And next one is the chemotherapy. So how to diagnose a case of polycythemia? Sometimes a person come to you with a polycythemia. So how will we diagnose the patient is having polycythemia? First one is check for the complete blood count. Check for the complete blood count. Here we can look for the CBC, in which we can see hemoglobin, TC, DC, WBC, etc. And most important one thing is the peripheral. Next important thing is the erythropoietin level. So erythropoietin level, the normal range of erythropoietin level will be 2.6 to 18.5. Okay, 2.6 to 18.5 milliunits per millimeter. Next, genetic testing. Genetic testing, the most important genetic testing include JAK2 gene. Okay, JAK2 gene. So the important blood test include complete blood count, peripheral smear, bone marrow test, hematocrit, then erythropoietin test, and gene test mainly include JAK2 gene. So the pathogenesis, The main pathogenesis is JAK2 gene. The JAK2 Janus kinase K2 gene mutation will be there. So the diet and regimen. Suppose if a patient is having polycythemia, along with our homeopathic medicine, we will be advising some diet and regimen to the patient. So the patients should eat the following diet: a calcium rich diet with dairy products, vitamin D rich foods should be supplemented. Then lean protein, fruits, vegetables, grains and nuts should be included in the diet. Then the foods to avoid include beans, berries, then alcohol, excess sugar, high fat, and processed food, along with the deep fried food. These are to be avoided. So this is a case report of a 28-year-old male who come to the OPD on 9/9/2021 with the complaints of back pain, pain in the left hip which got aggravated during standing, sitting and turning in bed, and also the blood picture release polycythemia. He presented with a reddish pimple-like eruption on the lower extremity, heel pain, dandruff and graying of hair, along with the sleeplessness, hemorrhoids and hypertension. So the complaint started on 31/5/2001 and he was under allopathic medication. He was undergoing phlebotomy for every 3 months. 500 ml of blood was drawn every 3 weeks. So he is also taking allopathic medication for hypertension and back pain. So this is the blood picture on 23rd May 2021. Hemoglobin 17.1, total count 88,000. Then peripheral smear shows polycythemia. And the past history before 9 months, the patient has diagnosed with the polycythemia and on treatment. So family history, father had hypertension. And regarding the personal history of the patient, he studied about diploma engineering, but he did not complete the course. And he is very anxious about his health and he is trying very hard to get a job. Appetite diminished, thirst good, sleep reduced, stool regular but have complaint of hemorrhoids occasionally, and constipation. On the local examination, we had manifest graying of hair, small eruption on lower extremity. So the main symptoms taken was mind anxiety, mind suicidal disposition, mind anger, mind concentration difficult, head dandruff, head graying hair, stomach appetite diminished, sleeplessness, anxiety from stomach, desire cold food, perspiration profuse, rectum hemorrhoids, generality orgasm of blood, back pain aching, skin eruptions, pimple like. So the medicines came was phosphorus 30 bar 13, lycopodium 30 bar 13, sulfur 29 bar 13, natramur 28 bar 13, and sepia 29 bar 12. So on important medicine for polycythemia and the synthesis was phosphorus. So the phosphorus medicine was given. The phosphorus medicine was given. Phosphorus 0 bar 3 in SL was given once in 2 weeks. The treatment was started from 9/9/2021 and continued till 30/9/2022. Total 26 dose of phosphorus 0 bar 3 was given, and with the uh, result, the treatment before the result before treatment was hemoglobin was about 17.4 and the peripheral smear shows polycythemia. And after this month of treatment, the hemoglobin level come to 15.1 along with the peripheral smear shows normal blood picture. So recently on 23rd October 2023, peripheral smear was again checked and the peripheral smear of the patient was normal. So the patient is undergoing regular blood checkup for every 6 months. So the informed consent of the patient was taken. So as we find that polycythemia is a rare condition. Okay, polycythemia is a rare condition. It is one of the blood cancer of the red blood cell. So it is to be deal very wisely. That the main symptoms will be presenting as, sometimes the patient will be presenting as hypertension, and sometimes the patient will be present as eruptions and itching of the body. The main thing is that we should be able to diagnose the case is polycythemia, and the main symptoms and the main investigations we should understand. So mainly we say that polycythemia is due to JAK2 gene mutation. So our homeopathic medicines will be very excellently acting in case of polycythemia. Thereby, even the genetic disease or the mutation can be revert back with the homeopathic medicine. So the medicine given was phosphorus syruba 3. Then and I thank each and everyone for giving me an opportunity to present. And I'm extremely sorry that I cannot share my screen. So if I may possible to share my screen, I will be showing the blood picture and also the investigation reports. And thank you, sir.
Yes, Dr. Amrutha, you have done a wonderful job, because we all know that it is very difficult to control and contain such cases, as well as the confidence of the physician to gain. Not easy. At the same time, a lot of criticism may also arise as a result of such treatment. But you have done a good job, and because of you have got the confidence and good education, that may be the reason you are successful in treating such cases. It's time for discussion. Those who would like to participate, please raise your hand so that we'll unmute you. The medicine you given was phosphorus, isn't it, Dr. Amrutha?
Yes, sir. Phosphorus was given, sir.
What about the repetition, dosage, and other general management in such cases?
Sir, phosphorus was given, about 26 dose of phosphorus was given. Phosphorus 0/3 was given in SL, and it was repeated once in 2 weeks.
Yes. Okay.
Yes, sir.
Unfortunately, some technical problems, you can't share your screen, isn't it?
Yes, sir.
Yes, it's a major setback. Kindly please participate in the discussion. The young talented physician, they need your support as well as your comments and some suggestions if you have. Experienced persons are there in this. Shaji Kudiat, did you listen the program, or you just joined? Shaji, the case of polycythemia. Yes,
Yeah,
Shaji, yeah.
ended after seeing your message of disturbance here. That's why I ended to check. But I lastly just ended 2 minutes ago only. So anyway, polycythemia management is a very important thing. And that is one of the cancer conditions of the blood cells. And I wish to suggest doctor not just treat with the medicines alone. There are some causes that produce the problem that we need to identify and correct also. And in polycythemia cases, so far in my observation, the sudden temperament and hyperactivity of the patient is very important. They are very jumpy. They are very hyperactive, basically in a hurried manner. They do things in a very hyperactive manner. Reactions are also very fast. So that I always notice in polycythemia cases. You also can observe such a things. So medication and medicinal management is one side of it. And there are some damages done to the vital force due to certain reasons. We need to correct, identify and correct that reasons also along with the medication. Our medicine will correct the damage, but if the fundamental causes are not identified and rectified, it will damage again. So the persistence of the disease will be happening again. So this is one thing I wish to remind you. And that's all. Medicinal management is also important. Along with that, this fundamental cause rectification is equally important. Take note of it. Thank you. You are doing a great job. And it is an inspiration for cancer management, especially blood cancer, because blood cancer is believed to be one of the most difficult cases for the allopathy, is because they do not identify the reasons, and that's the reason why it is difficult for them. And all types of blood cancer, when you manage with these homeopathic medication and root cause identification and rectification, along with the supportive treatment of blood transfusion or bloodletting of such kind of things, whatever needed according to the situation, will definitely give a complete resolution as the time goes.
Okay, Dr. Rajiv Kudiyat. Ahmad Hassan sir, what is your opinion? You are working in the laboratory a lot for a long time. And do you, Ahmad Hassan
Yes,
sir?
thank you very much. Sir, I have seen some polycythemia, as madam told very nice all new child when they born, their hemoglobin and hematocrit ratio is high. Naturally, due to it is by nature, just to um, during delivery they can be able to any obstruction and suffocation like this. And second thing also,
Again, some network problem maybe. Dr. Ganesh, please.
Yes, as there was some technical problem, Dr. Amrutha could not upload the PPT. Anyway, the presentation was excellent, and the case was presented here also was a very good one. And definitely, homeopathy can do wonders in those cases where the allopathic doctors find it very difficult to manage with them their medicine. They can do some wonders with surgery, but never they may not be able to do successful cases with homeopathy. But here, Dr. Amrutha described these things in a very good way, and we are lucky to have such sessions coming from Dr. Amrutha. She had presented some of the best presentation in this forum earlier, and all the presentation were brilliant. And since there was some disturbances from somebody who was trying to damage or spoil sports here on our session, I was not able to continue completely attend the session. I was just observing what is happening with this problem. First, I thought that it was my some mistake on my part. Then I realized that it is somebody who is trying to spoil this webinar. But anyway, we were able to manage the session without much trouble.
Yes, Dr. Ahmad Hassan sir is back again, Dr. Ganesh.
Yes, yes.
Sir, could you please continue? Yes.
yes, sir, maybe here some internet problem. Anyhow, sir, I saw this patient when any hill area in Abha, Saudi Arabia, too much patient polycythemia due to climate, due to less oxygen in the hill area. And I saw some patients which are undiagnosed, but pain is very severe in the back and this, and they diagnose very late and they suffer. Thanks, madam. Very nice presentation. One thing, the ratio of hemoglobin and hematocrit is 1:3, generally as a normal. But in these cases, the ratio between hemoglobin and hematocrit will be more, about 4. Suppose if hemoglobin is 10, generally hematocrit is 30 generally. But in these cases, when hemoglobin is 17, then it will hematocrit will be go up to 60. So thank you very much, madam, and definitely I will share this to my friends in Saudi Arabia. At present, I came back. I'm in Aligarh, but my good friends are there, doctors. I'll definitely share this.
Yes, that is the most important thing. You must share all these things to a common man. Definitely, they will benefit with this. Without these medicines, it's not at all possible to control or contain these diseases. But at the same time, Dr. Amrutha do it very beautifully. He has got a lot of talent and it proved a lot 100 times. Dr. Amrutha, what is your comment on that? Yes, please.
Good evening, sir. Sir, thank you for giving me an opportunity to present. It was a rare case, and the patient also have very confidence in our system. After the patient was under allopathic medication for 3 months, and the patient suddenly, when again after the further visit, the hemoglobin level was supposed to be normal, and the allopathy doctor asked him what medication he is taking. So suddenly he said that I am using homeopathic tablet. So he's a well-known, reputed doctor from allopathy hospital, and suddenly he shouted this patient in front of the whole patients, and saying that there is no such treatment available in modern medicine. Then why? What will the homeopaths do? So it was a great insult for the patient, and the patient come to me saying that the doctor has said like that. Then I told that it is the not the just leave it. Say whether you are okay now after every 3 weeks you have been going to take out the blood, and now you are perfectly okay. The patient said that doctor, I am now okay and I have full belief in the system, and I say that that's enough, and there is no need of further explanation from the doctor who does not accept our system.
Yes, they always claims they are scientific, but unfortunately, the mind has to be refined. For what purpose we are all doing all these things? For the patient, not for business purposes or anything else. To this.
This is a
But
common
what
thing.
happens is, yes,
Yes,
Dr.
this is
Ganesh?
definitely this is a common thing with most of the allopathic doctors. They don't know that all these things can be homeopathy doctors or Ayush doctors can do some treatment for these kind of things, patients. But unfortunately, they are not ready to accept it. And since the patient is sincere, they are coming back to us and telling what is happening with the other doctors around them. Anyway, your sincerity really does a great job for you for homeopathy, Dr. Amrutha.
Thank you, sir.
Fortunately, I am very happy that she is my student, Dr. Amrutha.
Yes, I know that. Because you are the person who brought her to this webinar, and after coming over here, she made some of our brilliant presentations. And this is also a very good session indeed. One for even without slides, we were able to complete the session.
Anyway, I think we can have another session from her, definitely, in the coming days.
Next time, if such trouble happens, we can you can send the PPT to us so that we will upload it from our side. Since
Yes.
it's very late, we could not do that.
I think we are not only promoting homeopathy, we are promoting homeopathists also. Then talented persons. We are always this our Dr. Guriviran, a lot of hundreds of doctors are present at this platform. They're all capable of doing wonderful job. Dr. Sumana Kumari Panda, what is your opinion? He is an experienced senior physician from Orissa, Dr. Sumana Kumari. Yes, please.
Thank you, sir.
Please.
The wonderful presentation. Really, Dr. Amrutha has given a new light. In cancer, I can say that our medicines are acting very well for palliative care. Even if in breast cancers, I have seen in my cases, after surgery, usually when I diagnose a case of cancer breast, I send him if the case is not in primary stage, not metastasized known, then I send the case for surgery. And after that, I continue with homeopathy constitutional remedy. And I have seen that the patient survives very well in normal, healthy condition for 15, 17, 20 years like that. So we are having much weightage in homeopathic medicines that can best palliate the cases. And Dr. Armada, what she told is really excellent presentation. For the youngsters, for many homeopaths, it is an inspiration, definitely. So thank you, Dr. Armada. And I want to know that whether she is continuing uh, homeopathic medicines only to the patient, or integrating with the allopathic medicines, or for management in emergency, whether she has taken support of the allopathic doctors. I want to know that. Dr.
Thank you.
Anmada, please.
Thank you, madam. Madam, he was in the early section, he was taking allopathic medicine, and after about 2 to 3 months of treatment, his blood pressure was absolutely normal, and he's taking medicine only for hypertension, and now he is totally under our homeopathic medication, and he is not going to the allopathic consultation again, and no bloodletting is also there. And for hypertension is also now controlled with this phosphorus medicine. And backache is also relieved.
For how many months are you treating the polycythemia, that case with phosphorus? And you have told with the 0/3. That is an excellent selection of remedy, because polycythemia, phosphorus is a very good hemorrhagic diathesis drug. So as we see in arnica, creosote, cyclicor, so phosphorus is of very deep acting. The pace of the drug is very deep. So whether that will for how many months you are treating that case?
Ma'am, the patient has came for treatment in May 2021, and I have treated
21.
yes, ma'am, May 2021 until this 39/2022. He was under the treatment, and latest report was taken on 1 minute, madam. Latest report was taken on October, that is the 23rd October 2023. The latest report was taken, and the blood pressure was normal, and the hemoglobin was about 15.2. And he's also occasionally visiting for taking medicine for his back pain, and there is no other symptoms other than that. And for after a very 6 months, I asked him to check the blood pressure and also the CBC with the peripheral smear, and it was normal.
Oh, good. But I will advise that you go for the hemoglobinopathies. The HPLC method, hemoglobinopathy is also in intermittently, and you can check his hemoglobin level in every 1 month or 2 months interval. So that will be better to know the conditioning of the patient.
Okay, ma'am.
Yeah.
I will do.
So
Thank you,
you
ma'am.
go for that, and I think that will be also in a very positive phenomenon, that is in a positive way, because the patient is improving means everything will be there. But if we will document everything in a 3 months interval, suppose we have taken the hemoglobinopathies, yeah, in 1 month interval only hemoglobin like that. So we can show to the other path, the other system of medicine, that these are we are not relieving only symptoms, but also we are pathologically the patient is improving. So that is my point to say. But you have done an excellent job. Really, I am on 1st November. I am also going to say on phosphorus cases, and you have shown also an excellent case of phosphorus. Really, phosphorus is a tubercular remedy Primarily, it acts upon the sora. Next, it tends towards syphilis. So, why it tends and how it tends, and you are saying sufficient reason is there, and you are saying the case of phosphorus in syphilitic stage. This is the stage of syphilis. You please take the mental symptoms in more detail, that you may find the syphilitic mental symptoms in that case, in that stage. You please take that.
Okay, ma'am. Okay, ma'am.
My point is that if you will go to the past history before 10 years, 15 years, 20 years, like that, 15 years, when the patient might not be syphilitic, he might be in the soric mental state, but now it might have transformed to the syphilitic mental state. So that you please verify in that case.
Okay, ma'am.
Anyway, thank you, Dr. Samana Kumari Panda, for joining this session as well as giving an input to Dr. Amida's presentation, and everything seemed to be good because phosphorus is a wonderful remedy in that all respects. It can act at any stage of a person's disease, whether it be a cancer, whether it be a case of dengue, whether it be a case of a viral fever, or whatever, even in case of prolapse of rectum, prolapse, severe bleeding, menstrual irregularities, fibrouterus, and all conditions. Phosphorus will help you and assist you, but nobody can say how it works, because that is the beauty of homeopathic medication. It is the patient that matters and not the disease. And Dr. Amrutha has shown how homeopathy works in those conditions where polycysthemia can also be corrected in that way, or bring the patient back to health with the homeopathic potencies. And I think Dr. Ramparisa sir is waiting for. Yes, you can speak now.
Thank you, Dr. Dhaneji, and Namaskar, Dr. Sumna Kumari Panda ji, Madam,
Namaskar,
and
namaskar.
Manoj ji. Namaskar,
Sabko
namaskar.
namaste.
Namaskar. And Dr. Manoj ji, congratulations, Madam, the very nice presentation and describe the medicine and select remedy phosphorus, antisoric remedy, polycythemia, just like cancer treatment is the very good select remedy, antisoric remedy. So very, very nice, Madam Ko. Yeah. Thank you. Thank you.
Thank you, sir.
And
Really,
Sumna Panda ji, very, very nice describe the polycythemia cases. Thank you.
thank you, sir. Manoj ji, thank you, and Dr. Dhanesh, all the thank you, namaste.
Yes, Madam, Samana Kumari Panda, Madam, you can say vote of thanks to the session also.
Really, vote of thanks is a customary to say, but IFPH, what I have found, the dedication of the leaders, the organizers to make the whole world, to bring wisdom regarding homeopathy to the whole world, to make homeopaths more and more knowledgeable regarding the different type of cases. So it is really a fantastic job and wonderful job the organizers are doing. So I must thank everyone that I'm getting opportunity to learn. I am learning from the wise people. So thank you everyone.
Thank you.
So on 1st November, I will present in Hindi session on the case study, evidence-based case study of phosphorus. In that also, I am going to say idiopathic thrombocytopenia, how he is surviving since last 2017 to 2024 with a platelet count 10,000.
Okay, we are waiting for the same.
So, and
Thank you,
why
madam.
I am saying, because I am very much, I became very excited to see phosphorus again with Dr. Armada. So really, phosphorus is an excellent drug. And thank you, the organizers. Thank you, Dr. Manojji, Dr. Danesh, Dr. Armada, and all the legendary doctors. So thank you, everyone. So with this, Dr. Dhane, so we will close I think we are going to close the English session.
Yes, yes, yes. Thank you, Dr. Sumana Kumari Panda, madam, and those who
Okay.
attended the session. Once again, thank you, Dr. Amrutha, for such a brilliant presentation here. And tomorrow we will have a session from Dr. Professor Baina Sharma, and Dr. will be talking about art and skill of observation in homeopathic practice. That's a very, very important subject. So hope all of you will be back with us tomorrow at the same time. Over to Dr. Manoj to moderate the Malayalam session. Thank you all. Good night.
Thank you, everyone.